The difference between X-rays and protons is that X-rays enter the patient, but they necessarily need to have exit the patient, and therefore they leave more dose inside the patient, whereas proton therapy, the particle enters the patient and it stops where the tumor is and doesn't exit the patient further. So overall, there's less dose of patient.
And lesser side effects. Hello everyone, and welcome back to our next episode of Clinically Speaking, our medical podcast. So I'm Marie, I'm a pharmacist and I'm your host for today, and I also have with me Evelyn, my fellow pharmacist and fellow host.
Hello, I'm Evelyn, and today we have two special guests with us here. Let's welcome Dr. Looi and also Dr. Shaun. Hello, doctors. Would you like to briefly introduce yourself to our audience?
Hi everyone, I'm Dr. Looi Wen Shen from Proton Therapy SG. I'm a radiation oncologist, and at Proton Therapy SG we give proton therapy. I've been in this field for more than 10 years and I've been a specialist for more than 7 years.
Dr. Shaun?
Yeah, my name is Dr. Shaun Ho. So I'm also a radiation oncologist, also working at Proton Therapy Singapore. And Dr. Looi is my colleague. We did our training together and we did our specialist training together, and now we're colleagues at Proton Therapy SG.
So before we talk a little bit about proton therapy, you said something about radiation therapy, right? Maybe you can start from there, like what is it really about?
Yeah, radiation therapy is a type of cancer therapy that typically uses X-rays or particles to generate free radicals within the patient's body that preferentially affects tumor cells, cancer cells, more than the patient's normal cells. And so we can treat tumors in this way by preferentially targeting tumor cells.
How does that work? Like, how does the X-ray know, like, where to kill the cancers?
So in general, when we plan our radiotherapy, we need to take into account the patient's condition. So the good thing about radiotherapy is that it can be used in more than half of patients with cancer. And when we do radiotherapy, we can use it in all stages of cancer. So we can do it either as the main treatment modality instead of surgery. We can do it before surgery to try to improve the outcomes of surgery. We can do it after surgery to reduce the risk of cancer coming back. And sometimes, of course, in patients who have a lot of symptoms from their cancer, we can use the radiotherapy to reduce their symptoms. For example, reduce bleeding or to reduce pain.
Is it for all types of cancers? Like, is it certain stages that can only use radiation therapy, certain stages you cannot use?
Or maybe even like using it together with medication. Is that something that's done?
So radiation can be used in all stages of cancer. So for example, in the setting of cancers where surgery is not feasible or where surgery can be very morbid and it can cause disfiguration, for example. So a good example might be head and neck cancers. For example, cancers in the throat or cancers, nasopharyngeal cancers, they are very deep. So surgery might be quite morbid for these patients. So what we do is we can cure patients still without surgery by using radiation. And sometimes to improve the outcomes of radiation, we add on chemotherapy as well. And when we do this radiation, we do it over a period of 6 to 7 weeks of treatment. And patients still have very good cure rates and they're able to preserve the function. For example, they still can retain their voice, they still can swallow, and they still can achieve cure.
But so it's X-rays, right? How is that delivered to the patient? How is that targeted?
So in the radiotherapy has really evolved over the many decades that it's been used. Mm-hmm. Previously, we used to apply radioactive substances to patients on the skin. Yeah. Subsequently, they actually used radiation emitting sources like cobalt to deliver radiation to patients from the external surface. Later on, we actually developed linear accelerators, which essentially accelerate electrons to produce X-rays. And as these X-rays are delivered to the patient, as my colleague had talked about, we use image guidance to make sure that we deliver the radiotherapy precisely. And over the last few decades, the image guidance has improved tremendously, and this has allowed us to really target cancers more and more precisely.
So Dr. Looi, just now from your introduction, you guys did mention that you guys are specialized in a treatment called proton therapy. So how is it like different from the standard X-ray radiation therapy?
Okay, first off, I think it's necessary to clarify that proton therapy has nothing to do with the car company Proton. It's got everything to do with the energy that's actually delivered to the patient. For traditional radiotherapy, we actually give X-rays, whereas for proton therapy, we deliver particles.
Is it a positive charge?
Yeah, positively charged particles that enter the patient. The difference between X-rays and protons is that X-rays enter the patient, but they necessarily need to have exit the patient, and therefore they leave more dose inside the patient. Whereas proton therapy, the particle enters the patient and it stops where the tumor is and doesn't exit the patient further. So overall, it's less dose to the patient.
And lesser side effects.
Yeah, it's reduced by about half, if not 2/3, the overall dose to the patient.
Interesting.
How do you count the dose? Like, how is it equivalent dose of X-ray versus proton? How is that calculated in some way?
Like equivalence.
Yeah, so we have this concept called radiobiological equivalence. So we do know that the ionizing energy of both proton and X-rays are actually quite similar. So we just use a simple calculation of about 1.1 and factor that into our calculations. Yeah.
Okay. So how I maybe you can like tell us a little bit about the kind of machines that y'all use. I mean X-ray, we see that a lot, especially when you go and like do our dental X-ray or like get our arm X-ray or something. But
Machine-wise, like, is it like very different from the standard X-ray RT and also the proton beam machine? Is it like very different, the machine-wise?
you hear big things about proton beam.
Yeah, so the standard X-ray machine is slightly bigger than the normal CT scanner, but the proton beam machine is actually much larger. So
Like how big?
How much larger?
yeah, so for our machine, we actually had to put in a couple of 100 piles.
Piles?
Yeah,
Piles
for
of?
foundation.
Oh,
To lay a new foundation for the building to actually accommodate the weight of the machine. And so it's not, although our treatment center is in the basement, the machine itself actually goes up to level 2 or 3.
wow.
Yeah,
The whole
because
thing
we
is like a
actually,
huge
yeah,
investment.
we actually,
So it's low on the ground, it's also high.
yeah, we actually house a particle accelerator. Although this particle accelerator is not as big as those in like Switzerland, for the usual research. It's a very compact particle accelerator.
It's still a whole freaking particle accelerator.
Yeah, so it's a compact solution, as they call it, for a particle accelerator.
Then how is it like maybe how, because I think there's not that many of these machines in Singapore, right? How is it like transitioning, working with radiation therapy versus proton beam? Was it difficult to learn, or like how was it like?
Yeah, so I think in general the concepts are quite similar in that when we plan our radiotherapy, it's always customized and tailored for every patient. So for a patient who's suitable or recommended to undergo radiation, they undergo a process called immobilization and simulation. So we then, so we do a scan of the patient, and then what we do as radiation oncologists is that we do the drawings and markings, we do a kind of a 3D modeling of the areas that we need to target, and with the type of proton beam therapy that we have nowadays, the most advanced form, which is called pencil beam scanning, we can actually pencil beam. That's right. So we can actually do what we call dose painting. So different areas will get different doses every day. Yeah, so it's a bit. So we work a bit like artists. So actually, we have a drawing tablet, and then we draw slice by slice.
Really use the pencil to draw.
Right. So we use a Wacom tablet, and then we draw. Yeah. So it can actually take a few hours to just draw out the radiotherapy kind of contours. So we draw both the targets that we want to treat, as well as we need to draw out the organs that we want to spare, because every tumor is always surrounded by normal organs that we want to spare. And then when we can draw and mark out the areas that we want to target and the areas that we want to spare, then our colleagues, who are called medical physicists, they take this drawing and information, right, and then they come up with a customized radiotherapy plan for the patient.
So how does the beam like enter the patient? So I mean, let's say you want to target like a tumor in my, I don't know,
Like brain.
brain.
No, I hope not.
Does it mean that you have to find like a way to kind of avoid the eyes or avoid the nose or something like that?
That's right.
But it will go from outside lah. Like I think for radiation, I've seen is there a way to like, for example, put a probe inside, then you can target from inside.
Yeah, that's called brachytherapy.
Breakthrough.
Yeah, brachy, I think, comes from the Latin word meaning inside.
Ah.
Yeah, if I'm not wrong, is it short? can't remember. Either short range
figure
or
it out.
inside. Yeah. I can't remember whether it means short. I think short actually. Yeah, where you insert probes into the patient and then the radioactive sort of material enters the patient and releases short range particles so you can treat locally. Brachytherapy is quite different from proton therapy. Yeah,
So proton therapy comes from outside.
it does come from outside. Only main benefit is that it goes in but doesn't come out. This allows more precise targeting of the tumor, but can also be a little bit of a double-edged sword because when you're more targeted, it also means that if you are not careful with what you're targeting, it's easier to miss.
Easier to miss.
Yeah, so you have to be very careful with your image guidance and also your planning to make sure that
The design.
the design of your fields. For example, if we're treating like the abdomen, we try not to shoot through any bowel because, for bowel, one day you can have a lot of gas, next day you can have a lot of...
It's going to be really difficult. If you're trying to shoot through the abdomen, you're going to hit some bowel.
Yeah, so we will usually, for abdomen, we'll usually get the beams in from the back.
That's why you need the guided.
That's your kidneys, man.
Yeah, so there's different ways of overcoming these issues. In a way, it's like dropping a precision bomb versus carpet bombing the whole area. Carpet bombing, you hit everything, but precision
That's
bomb...
like chemo. Chemo's really carpet bomb.
Yeah, so it's something like that.
I have another question also. So, like, how long does one treatment of proton therapy takes? Because just now I mentioned like how to do it and everything. So, like, for the duration wise,
Also
how long?
including the planning, which is a few hours of drawing, I bet.
Maybe from like patients like experience from drawing probably longer.
Yeah, so I guess for the actual treatment duration for each treatment session, it really depends on the complexity of the plan. For a simple kind of small target like the prostate, when you're just using 2 fields, the treatment time can be as short as 20 minutes to 30 minutes. And that includes the positioning, the pre-treatment scans, the verification adjustments, and the actual treatment delivery. Usually in and out, they can be done in 20 to 30 minutes.
How many sessions would they need?
So again, depends on the type of cancer. So certain types of cancers, like for prostates, oftentimes you can treat with just 20 sessions. Certain treatments, maybe livers, we might be able to treat with 10 sessions. For most head and neck cases, we might need to take between 33 to 35 sessions of radiation.
Okay, that's a fair bit.
Really depending on the.
Do they have to
treatment
rest
period.
between sessions? Like how long do they have to rest?
So usually it's one treatment session a day, most of the time.
Every day?
Yeah, every day.
Do
So
they have
Mondays
like
to
rest in
Fridays.
between?
They get the weekends. They get the
The
weekends to
weekends for the
rest.
doctors as well and the physicists.
Yeah, the other thing is also, I think some of the different machines also have different treatment speeds.
So it depends on the machine lah.
Yeah, because ours is a cyclotron, we can generate the proton energies that we need a lot more quickly. And also ours is a full gantry, 360 degrees, meaning that we don't have to turn the patient around to treat one half of the patient.
The machine will go around instead.
Wow.
Yeah, the machine can actually travel 360 degrees around the patient. For certain places where the room is smaller or due to cost issues, they have to just use a partial gantry, 220 degrees usually.
So they in the middle they will turn the
After-
patient.
Yeah, in the middle they'll flip the patient around, but it means they have to go in and reset up the patient again.
Oh, they have to remap and
More
And
time consuming.
remap, redo your image guidance, so it takes almost twice as long in that sense. Yeah.
Actually, you've mentioned things like prostate, liver, and then even like doing the abdomen, right? Is there any places you can't treat for proton beam?
Yeah, so in general, anything that you can treat with radiation, you can treat with proton beam therapy, right? But again, not everything needs proton therapy, right? So and it's also quite a limited resource. There is some financial toxicity with it. So we do want to select our cases to really those that benefit the most from it. Yeah, so
Targeted for the patients.
that's right. So especially for pediatric patients, which my colleague Dr. Looi sees a lot of, I think really pediatric patients benefit a lot from proton beam therapy because
The side effects profile, is it?
side effects and he can share a bit more about the advantages of proton in pediatric patients. Yeah.
Maybe you talk a little bit about the kind of side effects you may anticipate, especially for radiation and then also in comparison to proton beam. Yeah, I always hear like, I think the general public perception of cancer and cancer treatment is in chemotherapy. Like that's the typical one. So getting a little understanding about the radiation part would be pretty interesting.
Okay, so if we talk about pediatric brain tumors, I think this is probably one of the areas where you see some of the most benefit. So for children, we know that they're still developing. That's one. We also know that their normal tissues are a bit more sensitive compared to adults, partly because they're also developing. And also, if you treat, say, a 5 cm cube area, the relative proportion in a child is actually much bigger compared to a fully grown adult. Yeah. And also, children tend to have many years ahead to develop side effects compared to adults who may not have as much time left.
The lifespan.
So in children, we're thinking about 30, 40 years survival often. So if you just look at treating the brain, the impact can be things like reducing cognitive deficit, IQ and so forth. You may also reduce endocrine problems, meaning hormonal problems, because you can spare the pituitary gland or the hypothalamus. You may also
Probably also stop at the tumor site, right? Like what you mentioned just now.
Yeah, and so the big thing about children for stopping at the tumor site is actually reducing second malignancy.
All right.
This is very important for children.
In an adult, 70-year-old adult who you think may live another 10 years, it's not so important. But for a child who you are quite sure if they'll be cured, could be living for 30, 40 years at least, minimally.
They can really have that chance of developing.
Yeah, the chance of a second malignancy actually becomes significant. So they've done populational studies and found that you can actually reduce the risk of second cancers, especially in children, by up to 2/3 actually.
2/3 is a lot.
So it's a lot when the person has so many years ahead to live. Yeah, it's a little bit less if you're like 90 something years old or whatnot. So this is one of the big benefits for children. Another big benefit that you see, but this is more rare, is tumors that you need to really give a much higher dose.
Like
Kind of tumors would it be? Yeah.
So this would be things like chordomas, chondrosarcomas, some base of skull tumors, who you actually really need to give in excess of 74, 76 gray, which is just a unit of measurement, that you can really only deliver with particle therapy.
So if they were to undergo regular radiation therapy, it's probably not going to do anything.
Probably the chance of curing may actually drop. But the number of these patients is actually not that many compared to other patients where you just reduce the side effects. So it's either you reduce the side effects, which is most of the time, or you need to escalate the dose, which you may increase the cure rate, but that's fewer. Another area where you really reduce the side effects is head and neck patients, which my colleague, Dr. Shaun, really treats a lot of.
What kind of side effects? I think like all these long-term side effects is something that takes a while for people to see. But what would they expect immediately? Again, like nausea, vomiting, kind of thing.
So a lot of patients that we treat are also in adults are in head and neck cancers. So for example, nasopharyngeal cancer is a cancer that's endemic and very common in Singapore.
Is it caused by smoking?
No, it's just something that
like
seems to
genetic
happen
thing.
more in Chinese, especially.
Okay.
So it's very common in Singapore. And the good thing is that nasopharyngeal cancers are actually quite sensitive to radiation, so you don't need any morbid surgery to treat it. But because the location of this cancer is again at the back of the nasopharynx, so behind the nose, so it's quite surrounded by a lot of important structures, nerves, the brain, bone, and all that. And also when we use conventional radiation, so the good thing is that we can cure them a lot of the time, but it's often at the expense of a lot of side effects. So previously when you're treating head and neck patients with conventional radiotherapy, although the cure rates were very good, what we notice is that usually within the last few weeks of their radiation treatment, they tend to get a lot of side effects. And these side effects are often a lot of pain in their mouths, oral ulcers, sores.
Any skin?
Do they go through
side
the mouth
effects.
to deliver?
So the radiation conventional X-ray goes all around the head.
Yes.
So the beams go through even the oral cavity and all
Yeah,
that.
the oral mucosa will be
So,
very affected.
So they get a lot of oral ulcers, mucositis, and it's very common for patients at the end of their treatment to require high doses of morphine, fentanyl, which are very strong painkillers with side effects, nausea, constipation. Sometimes they only can take liquid diet. Sometimes in the patients who don't do so well, especially the more frail patients, they end up with a feeding tube.
Okay.
Sometimes if they really don't do so well, they might need to be admitted to hospital to manage the pain and to optimize their nutrition.
Just because they are completing their radiation
Yes,
therapy.
correct. And usually happens at the last few weeks of radiation. But what we notice now, at least for the patients that I've been treating using proton beam therapy, is that the patients complete their treatment and they pretty much sail through it. Or they still get some dry mouth, they still get some change in the taste, but they tend to recover. They tend to recover faster. And generally for pain control, some of them don't require any painkillers. Most of them just require Panadol or maybe a bit of codeine. So very mild painkillers that they can stop very quickly after their radiation. So there are cost savings as well. So apart from just, having better quality of life, less toxicities, but you also spend less
on other
your
bills.
other medications. You're less likely to need a feeding tube, you're less likely to need to be admitted. Right, so and generally the recovery process after their radiation is faster and they tolerate it better.
So is this treatment only available in Singapore, or like it's also available in some other countries, like from experience?
Yeah, so before we had proton therapy, I would send a number of my patients to Korea or actually also Japan and Taiwan also.
Anywhere closer, Southeast Asia.
Yes, so Thailand actually has the same machine as what we have here in
How many centers do they have in Thailand?
Thailand only has one center, one treatment, one proton therapy unit.
In
And
Singapore?
Chulalong, Singapore, we actually do have 3 centers, and they're all three are of different brands also.
Okay. Is it different, like using different brands?
Yeah, there's definitely differences between the 3 machines. Maybe Dr. Shaun can say more.
No, I think in terms of efficacy, all deliver the same most advanced form of proton beam therapy, which is, like I say, pencil beam scanning proton beam therapy. So in terms of efficacy, I think all are equally good. But there are some differences in terms of the machine, in terms of
usage.
in terms of the practicalities of how it's delivered, the treatment duration, how quickly it can be delivered, how long patients need to wait for their beam.
And whether they have or they're like full.
Yeah, correct. Yeah, that's right.
Yeah, sometimes also it depends on the mounting of the imaging. If the imaging is mounted on the wall versus on the gantry itself, it can cause collisions when you try to move the couch in certain
It's very physics to
directions.
us.
Yeah, so all the 3 machines have some differences. Yeah, there are some pros and cons of each.
So have you seen like overseas patients coming to your center?
Yeah, so I think Singapore is quite fortunate to have 3 proton centers. So regionally, like Dr. Liu was saying, there's only one other proton therapy center, and that's in Bangkok, Thailand. But there are no other proton therapy centers in Southeast Asia and even in Australia. None are operational yet. So I think Singapore is in a very advantageous position to be able to serve, both our local patients as well as patients in the region. Yeah.
Okay, so we've been talking a lot about proton beam therapy, and you've also been practicing this kind of newish technology for a while. I'm sure there's some interesting cases to share, right?
Yeah, recently I came across, not recently, but then I came across an article from just Straits Time. There's this pediatric patient with, I think, brain tumors, but then in the end, he got inspired to be one of the brain doctor after his proton therapy treatment. I think it's pretty interesting. Do you still remember this case?
Yeah, I remember this patient. It was a 9-year-old child with craniopharyngioma, which is a type of slow-growing tumor in children. So for him, there was a lot of benefit for proton therapy because we realized it would reduce the overall dose to his brain, maybe reduce any IQ loss from radiation therapy, reduce his risk of hormonal problems, reduce his risk of hearing loss. And so we felt that proton therapy was very necessary for him given his age. He's only 9 years old, and the prognosis for such patients is actually very good. It's nearly
slow growing, right?
It's nearly 100%. Yeah, and so at the end of treatment, he was inspired, actually not so much by me, but more by the neurosurgeon to become a brain doctor.
Co-inspired by you.
But did he get surgery as well, or was it just...
Yeah, so prior to the radiotherapy, he actually got surgery.
Bulking.
Yeah, this type of patients, generally they can do without radiotherapy for young children if you can get a complete resection. But for him, it was not possible. And so we administered radiotherapy in the form of proton therapy
After the surgery, right?
after the surgery was performed.
So if the surgery took up like the most of it, then you wouldn't need that many sessions.
No, the number of sessions is pretty fixed for craniopharyngioma. Usually we give 54 gray and 30 fractions over 6 weeks. Yeah.
It's very amazing how they can remember all these type of numbers to give for different type of cancers. Wow, I'm so impressed.
Or maybe is it because these are like kind of locked in like a standard protocol for a specific kind of therapy?
Yeah, so a lot of the things I do are quite ingrained. But then again, I could be quoting some kind of fake number and it would not.
We will go back and put a citation.
Yeah.
Yeah, so that's for pediatric patients.
Yeah, for that patient was a 9-year-old child. But now he's already 10 years old.
Okay, yeah, when was it? Like 2023?
He was our first pediatric patient in National Cancer Center. So he was treated in June 2023, if I remember, or July. Yeah.
So is
June or
he
July,
a local
yeah.
patients or like overseas patients?
It's our local patient. Yeah.
Quite interesting.
Oh, how about for yourself, Dr. Shaun? Like any interesting cases that you might rival this one?
Well, I don't really treat many PEDS patients. So most of my practice actually so far has been in head and neck cancers. And I think maybe not so much a specific patient, but I think really it's seeing is believing, because prior to this, when we treat our head and neck patients, like I mentioned before, a lot of them really struggle through their radiotherapy. And just being able to see my patients now, cruise through their radiation without any painkillers, I think to me that is pretty much one of the most amazing things I've seen. Being able to cruise through their radiotherapy, eating their regular diet, just taking some Panadol maybe before their meals, I think has been very satisfying. And still being able to achieve good cure rates, I think that has been very satisfying for me.
Okay.
Yeah.
Very wholesome stories, but I just wanted to ask like a question that usually people wouldn't like to ask is, do you see any relapses? Do you have any patients relapse, or do you have any patients who come back like with a
After they recovered.
they think you might have achieved the cure, but then they come back. Has that happened so far?
So I don't think I've seen any relapses that would have relapsed because they got proton therapy. So generally speaking, if you're using proton therapy to reduce side effects, the cure rate remains the same.
Yeah.
In fact, for certain conditions, we know that if you give proton therapy, you can increase the dose and potentially increase the cure rate. So those I've seen, when we use it for that particular reason. Otherwise, I haven't actually seen anyone relapsing because we use proton therapy instead of
That's pretty
X-rays.
rare.
Yeah. But let's say the cure rate is, for example, 50%, and there's a 50% chance of that person coming back. Has it happened yet? Or
So unfortunately, in the field of cancer treatment, a number of patients do relapse. Of course, it depends on the stage of the cancer they are diagnosed
So the
at.
disease.
Correct. So usually if it's an early cancer that's picked up early, like a stage 1 cancer, our cure rates can be as high as 90%. Usually just taking, for example, nasopharyngeal cancers. If you pick it up early, we can just give radiotherapy, whether it's proton or X-ray therapy. We might not need to use chemotherapy. Cure rates might be 90%. If they relapse, they often don't relapse right away. They may take a few years for it to come back.
years.
Yeah. So because proton therapy has only been in Singapore for less than a year, so thankfully, at least we haven't seen any relapses on our proton therapy patients.
Yeah, then actually your because you're called proton therapy, right? You offer also other services like together radiation therapy, or let's say you assess the patient and this patient should be treated with like chemotherapy, for example. Is that something that you offer as well?
We offer normal X-ray therapy, X-ray radiotherapy as well. Chemotherapy is usually administered by a medical oncologist, so we do refer to our colleagues for that.
It's a different specialty. Sure.
But to add on to your point earlier about the relapse rates and cure rates, I think in the field of oncology, relapses are something we just have to accept that will happen from time to time. Yeah, no matter what, even if it's a high cure rate, there's always that 10%, 5-10% of patients or what. Yeah.
If the cancer is already like at the late stage, right, is it still treatable by proton therapy? Like, is it like something to buy time for the patients with proton therapy?
So if it's very locally advanced, even if it's stage 4, but it has not spread to other parts of the body yet, so it's maybe just a very locally advanced cancer
Like the nearby area.
invading, for example, the brain or the bone, we still can use proton therapy. But if cancer has already, spread to other parts of the body, then oftentimes our medical oncology colleagues would, want to start with something a bit more systemic. That's right. So what I would say is that, certainly compared to last time, I think the field of oncology has advanced a lot. It's not just radiotherapy that has advanced. Even our medical oncology colleagues have more tools now. So certainly cure rates for cancer is much better now than even 10 years ago. And patients are, oftentimes even with stage 4 cancers, can be living for more than 5 years, and becomes more of it's more like a chronic disease. And so radiotherapy certainly has advanced as well. So I think we've come a long way, but of course there's still room for improvement, and we're always working, doing research and all that to try to, improve our patients' outcomes. Yeah.
And thank you so much today for the very fruitful sharing by Dr. Shaun and also Dr. Looi. I personally really learned a lot about this proton therapy. How about you, Marie?
Yeah, I think it's something that sounds really cool, and then it's another thing to really sit down with someone who has done it before and to talk about it. Yeah.
Thank you so much for having us today.
Thank you.
A very interesting conversation.
It's like biology and physics come together. We learn a lot.
All right. Thank you.
Thank you
See
very
you in
much.
the next one.
Bye.